So how common is obesity in dogs? Well, the most comprehensive study was actually published about 5 years ago and included thousands of dogs that were seen at over 50, I think it was actually close to 100 practices throughout the United States. And these were not academic practices. These were general practices. And what was found is that somewhere around 36 or so percent of the dogs at some point were considered overweight, and an additional probably about 8% were considered to be severely obese. You can notice in this slide that incidence kind of peaks out what would be considered kind of middle age range, and that 6, 7, 8, 9-year-old range. And overweight and obesity is less common in the younger dogs and less common in the older dogs. And one possible explanation, and we'll come to this, is when you're overweight or especially when you're obese or you have a dog that's obese at 6 or 7 or 8 years of age, they are less likely to live as long as a lean, body-conditioned dog of the same age and gender and breed. And what are some of the health risks associated with obesity? And it's certainly known much more in humans than in veterinary medicine. We know that in humans, in people, that high blood pressure, type 2 diabetes mellitus, coronary heart disease, and heart attacks, gallbladder disease, cancers, blood fat disorders, stroke, osteoarthritis, sleep apnea are all associated with obesity. When you look at the associations of obesity with other conditions in dogs, they look fairly similar. There are, again, metabolic alterations, blood lipid disorders. It's associated with certain endocrine diseases like thyroid problems or adrenal gland problems. There is a big association with osteoarthritis and cruciate ruptures, intervertebral disc disease, even associations with urinary problems like stone disease, urinary incontinence, and certainly cardiorespiratory diseases such as laryngeal paralysis or heart problems, even associations, again, with cancer such as mammary cancer, similar to breast cancer in people, but mammary cancer in dogs, and even bladder cancer in dogs. What's interesting, if you look through this list, and again I'm coming to it, is that many of these diseases and associated conditions are inflammatory in nature. And what is being discovered in humans, and now we're discovering it more in dogs and cats, is that obesity and that excess fat tissue is in fact a very active endocrine organ that produces a lot of substances, including inducing an inflammatory state. In fact, the association of obesity with diseases in people is so striking that there is something called metabolic syndrome. And what this refers to is a group of at least 3 out of 5 common problems associated with obesity. One, of course, is that there is obesity. And again, it is the distribution of the fat. So this is where there's more fat in the abdominal, in the belly, and sort of that apple-shaped appearance. With that obesity, then there may be impaired glucose metabolism. So their your blood glucose may be higher than normal, which implies some insulin resistance, maybe preceding the onset of actual diabetes mellitus. There may be an association with high blood pressure, and there are associations with blood fat disorder. So the triglyceride levels are high, and the HDL, the good heart-friendly cholesterol, are low. Now, is there such a thing as metabolic syndrome in dogs and cats? And the answer is there probably is, in many people's opinion. In the one and only but very well done study looking at the influence of body weight on lifespan in dogs, when you compare even just compare the overweight dogs, so these are dogs with 25 or 35% body fat, with the obese dogs, whose body fat content is more than 35 to 45%, the obese dogs, the ones with more fat, had higher blood glucose levels, sugar levels, had higher insulin levels, so some insulin resistance, and had higher blood fat levels. So they're obese, had insulin resistance, and had blood lipid problems. Those are all the things, or 3 of the traits that result in a diagnosis of metabolic syndrome in humans. What's interesting out of that study is what they did was they took litter mates that were Labradors, and at 6 weeks of age, they paired them out, and they were fed two different types of, two different ways. They were all fed the same food, but one group of those litter mates were fed a control feeding, so sort of unlimited, or they figured out how much they were eat, and then the paired dogs with each of those in the control feeding were fed a quarter less of the calories, so they were diet restricted. They began feeding them at 8 weeks of age. They kept them on the same diet throughout their life, and they followed them out until death, basically. What they found is that the dogs who were fed 25% less calories, on average, lived 1.8 years longer. So these dogs would live about 13 to 14 years, these Labradors, versus around 11 to 12 years in the overweight and obese dogs that were the control dogs. There was no adverse effects of limiting energy intake and keeping the dogs a little bit on the lean side. In fact, what they found is that when they as they got older and they kind of reached their obese state and kept it there, that it actually predicted their death about a year prior to death occurring because they started to lose lean muscle mass. And again, these dogs, as I showed you, that were fed unrestricted, the control dogs, had insulin resistance and other chronic diseases such as osteoarthritis, which is an inflammatory disease. What causes obesity? Well, in simple terms, it's too much energy in and not enough energy out. When we take in energy, then the expectation is we're going to expend it by breathing, by having our heart beat, by walking, by running, by exercising, by moving around, going up and down stairs. When we take in energy and we don't use it all for activity, then the body smartly stores it for a time when you're not eating. And of course, you don't eat all the time, or at least most people don't, and most dogs don't. And so in between meals, then we pull on those reserves to provide the energy required for activity and for living, breathing, heart beating, all of that. So when energy intake exceeds energy expenditure, then the body stores that in fat, and that in the hopes that at some point we will mobilize that fat and use it for energy. That's a very simplistic way of looking at it. It's much more complicated than that, but that's kind of at the heart of everything. The things that may result in an increase in intake with a decrease in activity relate to the environment, whether they're indoors only or whether they're allowed to access in and out, or running around in the backyard, how much exercise they're provided. It's related to their gender. Obesity is more prone to occur in female dogs when compared to male dogs. We know certain breeds, such as boxers and retrievers like Labradors, Beagles, they have a much higher incidence of obesity, while other breeds of dogs don't. When you spay or neuter, the energy requirements go down, and so you can feed less, and if you don't restrict the diet some, then that decrease in energy expenditure from being spayed or castrated, neutered, then is an increase in risk. And then again, I showed you that obesity is more common to occur in kind of middle-aged dogs and trails off as they become older. So again, females are at a higher risk than males. That doesn't mean males can't become obese. Again, reproductively neutered pets versus reproductively intact, increasing age in certain breeds. And interestingly, from a human-animal bond standpoint, some studies show that obese dogs or cats are actually more likely to be owned by middle-aged or older humans who themselves are overweight or obese. So they share the same environment and the same habits, and so they're prone to very similar problems such as obesity. And this occurs not in a linear fashion. That isn't that you gain weight, every day you gain a pound. You kind of gain weight and then you level off for a while, and then something changes and you gain more, and then you level off, and you just kind of keep climbing the stair, as it were, so that you end up with an increase in body fat and obesity, but it doesn't occur as a constant rate. You, again, kind of stair-step your way up, sort of like the way children grow. There's sort of these spurts. The bottom line is being too positive causes obesity. Too much energy in, a positive energy intake versus how much is spent. Now, I won't go into all of the very interesting things that are being discovered about obesity beyond just too much energy in and not enough out. There have been shown in humans, and now we're finding in dogs and cats, that it's more than just that. That there's problems with a feeling of fullness, that some people, just eat and they never actually feel full, and that allows them to keep taking more in or promotes them to take more in. There's some neurologic issues with it, not only from a behavioral standpoint, but actually kind of rewiring of the nervous system so that you don't burn the energy off that you're taking in as well. Brown fat, for example, which humans have quite a bit of compared to dogs, brown fat is a metabolically active sort of fat that is involved with temperature regulation and body temperature and energy expenditure, and that brown fat sort of disassociates itself from the capability of burning that, producing that energy and burning that excess fuel. And then again, fat is an inflammatory organ. It's an endocrine organ. It produces something called adipokines, which are hormones that signal other organs to do things. For example, it produces substances that tells the brain, keep eating. And it also recruits inflammatory cells in, which release products that result in associated conditions such as arthritis or skin disease that are inflammatory in nature. The idea that fat was more than just a storage form of energy came out of some of the original work looking at something called leptin. And these are a slide of both a child and mice, that the mouse on the right is deficient in the receptors for this hormone called leptin, which is actually produced by the fat cells. And what these mice do is they just continue to eat, and they eat so much they become obese. And that's what the mouse on the right did. It's been found genetically to occur rarely in people, and in children, then it results in obesity because of this inability to stop eating. Once they're given leptin, then they can regulate their intake and they can lose weight. And so the two images on the left of the boy compared to the two images on the right show the before and after leptin treatment. And it was one of the first fat-produced hormones that was found, and that led then to a lot of research in the last 10 to 15 years looking at what all does fat really do, and then what can we do to change that to help humans, people, and dogs and cats and horses and other species to not become obese.